If you want to lower your risk of stroke in the United States, the most powerful strategy is to take control of the basics: blood pressure, smoking, exercise, nutrition, weight, cholesterol, blood sugar, alcohol, heart rhythm, and sleep. Because stroke prevention isn't one silver bullet. It's a set of daily choices that compound over years and protect your brain and your heart. Let's start with the single biggest lever: know your numbers and control your blood pressure. High blood pressure, often called the silent killer, is the number one modifiable risk factor for stroke, and millions of Americans have elevated readings without symptoms. Book a real baseline check, buy a validated home cuff, track morning and evening readings for 2 weeks, and take that log to your clinician. Together, you'll set an evidence-based goal, often under 130 over 80 millimeters of mercury depending on your overall risk. Then use a stepwise plan: weight loss if needed, regular physical activity, lower sodium, more potassium-rich foods unless you have kidney disease, stress management, and, when required, safe modern medications taken consistently. Treat home monitoring like brushing your teeth. Same time each day, seated, feet flat, arms supported, and average at least 2 readings per sitting. Keep a simple rule in mind: every point you shave off your systolic pressure meaningfully reduces future stroke risk. Small improvements, sustained over time, add up to big protection. AHRA Journals +1. Next, stop smoking and avoid secondhand smoke. Full stop. Smoking damages vessel walls, raises clot risk, and ages your arteries. Secondhand smoke also increases stroke risk for the people around you. The good news is that your risk starts dropping as soon as you quit and continues to fall the longer you stay smoke-free. Make a quit date, remove triggers from your home and car, and talk with your clinician about proven tools: nicotine replacement, varenicline or bupropion, and free counseling programs. If you vape nicotine, treat it as a bridge to zero, not a permanent substitute. If someone in your household smokes, turn your home and car into smoke-free zones today. Your brain will thank you. Third, move your body most days of the week, because physical activity is one of the most reliable ways to lower blood pressure, improve cholesterol and blood sugar, maintain a healthy weight, and keep your arteries flexible. Aim for at least 150 minutes per week of moderate intensity activity like brisk walking or cycling, plus 2 brief sessions of strength training. If you're starting from zero, begin with 10 minutes a day and add 5 minutes each week. Build movement triggers into your routine. Take calls on a walk, set a sit less timer every 30 to 60 minutes, and make weekends about long, easy sessions you actually enjoy. If your knees complain, pool walking or an exercise bike can deliver the same heart and brain benefits with less joint stress. Fourth, eat for brain-healthy arteries with a Mediterranean or DASH-style pattern. Think plants first, then fish, olive oil, nuts, beans, whole grains, colorful fruits and vegetables, and low-fat dairy. Limit red and processed meats, refined grains, added sugars, and ultra-processed snacks. Be intentional about sodium. Most Americans consume too much without realizing it, especially from restaurant meals, deli meats, canned soups, frozen entrees, sauces, and takeout. Read labels, choose low-sodium versions, cook more at home, and keep your total sodium under 2,300 milligrams per day, about a teaspoon of salt, or lower if you have high blood pressure and your clinician recommends it. Flavor with citrus, herbs, garlic, vinegar, and spices instead of the salt shaker. Small swaps: unsalted nuts for chips, seltzer for soda, olive oil dressings for creamy sauces, pay off. Fifth, aim for a healthy weight and waist, not a specific look. Excess body fat, especially around the abdomen, drives up blood pressure, raises inflammatory markers, and worsens insulin resistance, all of which increase stroke risk. If you need to lose weight, a realistic target like 5 to 10% of your current weight over 6 to 12 months can meaningfully improve your blood pressure, cholesterol, and glucose. Use a habit stack approach. Add one sustainable nutrition change, protein and fiber at each meal, and one activity change, a daily 20 to 30-minute walk. Then build from there. Pair your scale with non-scale wins, better sleep, easier stairs, looser waistband. If you've struggled for years, ask about comprehensive approaches, nutrition coaching, medical nutrition therapy, and, when appropriate, FDA-approved anti-obesity medications, always wrapped in lifestyle support. 6. Manage your cholesterol with a mix of food choices and, when indicated, medication. LDL cholesterol contributes to plaque buildup in your arteries, including the carotid and cerebral vessels linked to stroke. At your next visit, ask for a fasting lipid panel and an ASCVD risk calculation. That 10-year risk score helps determine whether you'll benefit from statin therapy for primary prevention, how aggressive your LDL goal should be, and whether add-on therapies are needed. Emphasize dietary patterns rich in soluble fiber, oats, beans, lentils, berries. Swap saturated fats for unsaturated fats, olive oil, nuts, avocado, and keep trans fats out entirely. If your clinician prescribes a statin, take it consistently. These medications are among the most studied and effective tools we have to prevent heart attack and ischemic stroke in the right patients. 7th, prevent or tightly control diabetes because elevated blood sugar accelerates damage to the blood vessels that feed your brain. Ask for an A1C check if you haven't had one in the last year. Learn your personal targets and build a plan you can live with. A balanced plate emphasizing fiber and protein, predictable meal timing, daily movement, and glucose-lowering medications when needed. Even without a diabetes diagnosis, prediabetes is common and reversible for many people with weight loss, nutrition changes, and exercise. The same routines that improve glucose also lower blood pressure and improve lipids, making this a triple win for stroke prevention. If you use a CGM, continuous glucose monitor, focus on trends in time and range, not perfection. Use what you learn to fine-tune meals, sleep, and activity. 8th, keep alcohol modest. Heavy drinking raises blood pressure, triggers atrial fibrillation, and increases stroke risk. Even moderate intake isn't protective for everyone. If you drink, cap it at no more than 2 standard drinks per day for men and 1 for women, and many people do better aiming even lower, especially if they have high blood pressure. Workdays alcohol-free plus smarter weekend portions is a practical pattern that helps many Americans. If you're using alcohol for stress relief or sleep, know that it backfires on both. Swap in wind-down routines that actually improve sleep quality and blood pressure, like a short walk after dinner, a warm shower, a book, or guided breathing. 9th, detect and treat atrial fibrillation, AFib, a common heart rhythm problem that multiplies stroke risk because blood can pool and clot in the heart. Then travel to the brain. Learn the symptoms: palpitations, fluttering, fatigue, shortness of breath. But remember, AFib can be silent. If you're over 65, have high blood pressure, diabetes, sleep apnea, or a family history, talk to your clinician about pulse checks, EKGs, or consumer devices validated to detect irregular rhythms. If you have AFib, your team will estimate your stroke risk and may recommend anticoagulation. When appropriate and taken correctly, these medications are highly effective at preventing AFib-related strokes. Lifestyle still matters. Weight loss, steady exercise, alcohol moderation, and sleep apnea treatment can reduce AFib burden and support rhythm control strategies. 10th, guard your sleep and treat sleep apnea because healthy sleep is now recognized as a core pillar of cardiovascular and brain health. Adults should aim for 7 to 9 hours of consistent, high-quality sleep. If you snore loudly, wake up unrefreshed, feel excessively sleepy, or your partner notices pauses in your breathing, ask about testing for obstructive sleep apnea. Untreated apnea raises blood pressure and worsens atrial irritability, both tied to stroke. Continuous positive airway pressure, CPAP, and other therapies can improve daytime energy, blood pressure control, and heart rhythm stability. Build sleep hygiene, fixed wake time, a dark, cool room, a 30 to 60-minute digital wind down, and caffeine cutoff by early afternoon. Treat sleep like a prescription you fill nightly for your brain. Now, a rapid-fire checklist to tie it all together. Schedule an annual wellness visit and know your baseline risks. Monitor blood pressure at home and act on the trend, not a single reading. Commit to smoke-free living and protect your household from secondhand smoke. Earn your 150 minutes of weekly movement in ways you actually enjoy. Upgrade your plate toward Mediterranean or DASH patterns and audit sodium back under 2,300 milligrams per day. Set realistic weight goals and chase habits, not perfection. Check your lipids and discuss statins if your 10-year ASCVD risk is elevated. Screen for diabetes and take prediabetes seriously. Keep alcohol light or none. Screen for AFib if you're in a higher risk group and follow anticoagulation plans if prescribed. Prioritize sleep and treat apnea. One more important myth buster. Daily aspirin is no longer recommended for most people to prevent a first heart attack or stroke. If you're 60 or older, do not start low-dose aspirin for primary prevention unless your clinician specifically advises it. And if you're 40 to 59 with higher cardiovascular risk, the decision is individualized. Never self-start. Always discuss your bleeding risk and overall profile with your clinician. Finally, remember that stroke prevention is lifelong, but it doesn't have to be overwhelming. Pick one lever this week, maybe home blood pressure monitoring or a 20-minute nightly walk, and stack small, repeatable wins. Replace "I need willpower" with "I need systems." A water bottle on your desk, pre-chopped veggies in your fridge, sneakers by the door, a calendar reminder to refill your medications, and a sleep alarm to start winding down. Share your goals with someone you trust and make it social. Join a walking group, cook Mediterranean-style meals with family, or challenge a friend to a sodium label showdown at the grocery store. Your brain is worth protecting, and these everyday choices, sustained over months and years, are how you prevent the stroke that never happens. If you want, I can also deliver this as a 15-minute voiceover script split into scenes with on-screen text cues and a US-focused SEO pack, title, description, hashtags, keywords, tailored for your next-gen health channel.